Hello guys, welcome to Rebuild Academy. My name is Adil Momin and I welcome you to the ninth part of our series From Virus to Vaccine, Let's Fight Infodemic. I hope you all are doing well, fighting pandemic as well as infodemic. But before we begin, let me tell you a very important point. It is extremely important and highly recommended to watch this series in order. Only then you will get a complete idea and a clear picture of every concept involved. The link is given in the description. Now, let's begin. In the previous discussion, we discussed in detail medical diagnosis, clinical and laboratory diagnosis, molecular and imaging test. We talked about who should get tested for COVID. We also discussed the difference between screening and diagnostic tests. Then we briefly talked about the RT-PCR test, rapid antigen test and rapid antibody tests. Right. Today we will discuss medical treatment, different types of medical treatment. Then we will discuss preventive treatment for COVID. After which we will briefly talk about smallpox disease. You will get its context once we start our discussion on immunization and its history. We will also discuss types of immunization, and in the end we will go through different steps and methods involved in the vaccine making process. Okay then, let's begin. Before we begin our discussion on medical treatment, it is important to note that we are going to discuss treatment methods of modern or mainstream medicine, or more commonly known as allopathy. It is not the only medicine method today, but arguably the dominant one. Other types of approaches to medicine are referred to as complementary and alternative medicine. These include homeopathy, naturopathy, Chinese medicine, Ayurveda. The word allopathy was coined by German physician Samuel Hahnemann in the 1800s. It roughly refers to treating a symptom with its opposite, as is often done in mainstream medicine. For example, constipation might be treated with a laxative. Hahnemann was interested in other approaches based more on ancient principle of treating like with like. He later left mainstream medicine practice and is considered to be the founder of homeopathy. Based on the historical definition of the term, some physicians argue that it was used to falsely label mainstream medical practices. Many in mainstream medicine consider the term derogatory. But we are not going into the war of names and faces. Just get back to our topic of medical treatments. So, from now onwards, when I say medical treatment, it means medical treatment in modern or mainstream medicine. Okay. Medical treatment methods can be broadly classified into three categories: preventive treatment, symptomatic treatment, and curative treatment. Preventive treatment aims to avoid illness. It deals with the ways by which we can reduce the chances of getting the disease and reduce the susceptibility to disease. Quitting smoking, alcohol, and maintaining a healthy weight and healthy eating habits are some of the lifestyle changes that can improve your chances of a healthy life, and hence these are part of preventive treatment strategies. Medical testing and screening are also used as a tool in preventive treatment. For example, blood pressure testing, diabetes and cholesterol testing, cancer screening are part of preventive treatment. It is recommended to do these tests and screening for early detection of disease, which makes its treatment more effective. The next treatment method is symptomatic treatment. It involves relieving symptoms. For example, if you are having pain, then analgesics or painkillers are used. To control the inflammation, anti-inflammatory agents are used, and to reduce fever, antipyretics are used. Symptomatic treatment methods are widely used in the treatment of infections. And another medical treatment method is curative treatment. This method aims to cure the disease. It involves the use of antibiotics in case of bacterial infection, surgery to remove the damaged part, and in case of fractures, the plasters are used. So these were three major medical treatment methods. Now let's talk about preventive treatment. We will specifically talk about preventive treatment regarding COVID. In preventive treatment for COVID, we will discuss ways and methods used to ensure that person does not get COVID. There are two methods by which it can be done. The first one is COVID appropriate behavior and the second one is immunization. Now let's talk about COVID appropriate behavior. There are a couple of things that we will discuss here. Let's start one by one. The first one and most important is washing hands and using a sanitizer. We know that SARS-CoV-2 is an enveloped virus which makes it weak against disinfectants, and washing hands and using sanitizer helps to destroy the virus present on the hands. The next one is covering the mouth and nose while sneezing and coughing. We have seen the chain of infection of COVID and we know that mouth and nose are portals of exit and entry for the virus. Thus covering them helps to break the chain of infection. We also know that SARS-CoV-2 can survive on surfaces. That's why cleaning and disinfecting surfaces, especially those which are commonly used such as door handles, lift buttons, should be disinfected frequently to avoid the spread of the virus. Another important COVID appropriate behavior is social distancing. We know that modes of transmission of SARS-CoV-2 is droplets and air, which mean the virus can be effectively transmitted between people when they are close. It is recommended to keep a distance of 6 feet between two persons for social distancing. Wearing a mask is a key COVID appropriate behavior. The mask is used as a barrier for portals of exit and entry of the virus, thus effectively breaking the chain of infection. It is recommended to use N95 mask, which prevents 95% of very small particles, including droplets containing the virus. But walled N95 masks are advised not to be used because they don't prevent the exit of the virus from the mask. But you can also use the homemade masks made according to the guidelines by health authorities. Touching face and eyes frequently can enable the virus to enter your body through mouth and nose. Care should be taken, especially in the case of children who touch their faces and eyes more often, so washing their hands frequently is recommended. There is one related concept that I want to discuss here, which is quarantine. Quarantine helps prevent the spread of the disease that can occur before a person knows they are sick or infected with the virus without feeling symptoms. People in quarantine should stay home, separate themselves from others, monitor their health, and follow directions from their state or local health department. People are also confused between quarantine and isolation. Quarantine keeps someone who might have been exposed to the virus away from others. Isolation keeps someone who is infected with the virus away from others, even in their home. The time of quarantine is different in different countries. According to CDC guidelines, as of now, it is recommended to quarantine for 14 days and watch out for any symptoms during this period. And it is better to get yourself tested. So these were some of the major COVID appropriate behaviors. Now before going to the next topic of immunization, let's briefly go through smallpox. The origin of smallpox is unknown. The finding of smallpox-like rashes on Egyptian mummies suggests that smallpox has existed for at least 3000 years. Smallpox is a contagious disease. The initial symptoms of the disease included fever and vomiting. This was followed by the formation of ulcer in the mouth and a skin rash. Over several days, the skin rash turned into characteristic fluid-filled blisters with a dent in the center called pustules. The bumps then scabbed over and fell off, leaving scars. On an average, 3 out of every 10 people who got it died. People who survived usually had scars which were sometimes severe. Smallpox is a disease caused by viruses from orthopox viruses, which is a family of viruses. Variola is a virus responsible for smallpox in humans, which is highly contagious. Another member of the family is cowpox, which primarily infects the cows, making them ill with the disease of similar symptoms that of smallpox. This virus can also infect humans through zoonosis, but the symptoms are much milder than smallpox. Vaccinia is another member of the family which closely related to the cowpox virus. The vaccinia virus is the source of the modern smallpox vaccine, which the World Health Organization used to eradicate the smallpox in a global vaccination campaign from 1958 to 1977. These three viruses are related to each other. Monkeypox is also one of the member of the family, but it is not related to the variola virus, but it can infect humans. Now let's start discussing immunization. Immunization is a process of fortification of the immune system against an antigen. You can imagine this as a war exercise in which the defense system is familiarized with the enemy and trained to counter it. There are two ways of immunization. One is active immunization and the other is passive immunization. Active immunization is achieved by direct exposure to antigen. Direct exposure can happen either by natural infection or by implanting the antigen in the body, which is called inoculation. So, inoculation means implanting an antigen in the body. Now, inoculation can be done in two ways. The first one is known as variolation, which is an ancient method of inoculation. The Chinese practiced the oldest documented use of variolation, dating back to the 15th century. They implemented a method of nasal insufflation, administered by blowing powdered smallpox material, usually scabs, up the nostrils. According to such documentation, mild smallpox cases were selected as donors to prevent serious attacks. The technique used scabs that had been left to dry out for some time. Fresh scabs were more likely to lead to a full-blown infection. 3 or 4 scabs were grounded into powder or mixed with a grain of musk and bound in cotton. Infected material was then packed into a pipe and puffed up the patient's nostrils. Variolation cases were treated as if they were infected as those who had acquired the disease naturally. These patients were subsequently kept apart from others until the rash had cleared. India has been suggested as another possible origin for the spread of variolation into Europe, particularly the Ottoman Empire and Wales. Reportedly by 1768, inoculation was being practiced in Bengal. The doctor who performed this procedure were known as tikedars. The term tika is still in use now to mean vaccination in many Indian languages. Similar methods were seen in the Middle East and Africa. Two similar methods were described in Sudan during the late 18th and early 19th centuries. Both had been long established and stemmed from Arabic practices. Tishteri al-Jidderi, that is buying the smallpox, was a practice seen within the women of Sennar in central Sudan. A mother of an unprotected child would visit the house of a newly infected child and tie a cotton cloth around the ailing child's arm. She would then bargain with the child's mother over the cost of each pustule. When a bargain was struck, the woman would return home and tie the cloth around her own child's arm. The second method was known as Dak al-Jadri, that is hitting the smallpox, a method similar to that used in the Ottoman Empire and eventually transported into England. Fluid was collected from a smallpox pustule and rubbed into a cut made into the patient's skin. This practice spread more widely through Africa. So, these were the roots of modern vaccination, known as variolation. Since the live and unmeasured quantity of virus was used to induce immunity, in this case, there was always a chance of full-blown infection, which can be deadly in some cases, so was not a safe procedure. Now here comes the story of Dr. Edward Jenner, often called as the father of immunology. He observed that dairy maids who contracted cowpox from cows and later recovered do not get infected due to smallpox. That is, his hypothesis was the person who has recovered from cowpox get immunity to smallpox. To prove his hypothesis, he picked up a subject named Philip, an 8-year-old son of his gardener, and inoculated him with cowpox pus from Sarah Names, a milkmaid infected with cowpox, after which James fell ill with a mild case of cowpox and recovered. Then scabs are collected from smallpox patients and James is inoculated with those scabs. It was observed that James did not develop any symptoms of smallpox, and hence it was deduced that he has got immunity against smallpox. Jenner successfully tested his hypothesis on 23 additional subjects. Moreover, he demonstrated that the protective cowpox pus could be effectively inoculated from person to person, not just directly from cattle, known as the arm-to-arm method, but there were disadvantages associated with the arm-to-arm method. It was found out that arm-to-arm methods of vaccination is causing the spread of blood diseases like hepatitis. So, to overcome this, retro-vaccination method was invented. In this method, a healthy cow was infected with the pus of cowpox of humans, and then other humans were vaccinated with the pus from pustules of the cow. In this way, the technology and methods evolved, and we see modern vaccines today. Louis Pasteur produced the first laboratory-developed vaccine, the vaccine for cholera, which is a bacterial infection. Passive immunization is achieved without direct exposure to the virus. Passive immunization can be natural, for example, from mother to child or from injection, for example, gamma globin. Passive immunization can provide immediate immunity, but it is not long-lasting. Now let's discuss the modern methodology of making vaccines. We will only discuss the major steps involved without going into minute details. The first step is the generation of the antigen to induce an immune response. This step includes the growth and harvesting of the pathogen itself, or the generation of recombinant proteins, which is a protein made with a DNA of a virus in the laboratory. For viral vaccines, this procedure begins with a small number of specific viruses that can be grown in cells. Various cell types may be used, such as cells from chicken embryos or cattle. There are allegations that aborted human fetus cells are used in vaccine making. According to experts, none of the vaccine makes use human body parts, let alone an aborted baby fetus. Vaccines are made using a cloned version of human cells, which is a common process that doesn't hurt or harm humans. Bacteria can be grown in bioreactors, which are much like fermenters. Some antigens can be manufactured within bacteria or yeast. The second step is to release the antigen from the cells and isolate it from material used in its growth. The goal of this stage is to release as many viruses or bacteria as possible. The third stage is the purification of antigen. Proteins and other parts of the growth medium may still be present. They are removed in this stage. Chromatography, which is a method of separating materials, and ultrafiltration are used for this purification. So, now you can understand why the allegations that human cells or cattle cells are used in making vaccines are irrelevant, because they are only used as a medium for the growth of pathogen and are removed afterwards and are not present in the final product of the vaccine. The next step is strengthening the vaccine. It may involve an addition of an adjuvant, which is a material that enhances the immune responses. Adjuvants alert the immune system. Vaccines may also include stabilizers. Stabilizers are used in vaccines to protect the integrity of the vaccine ingredients during manufacture, storage, and transport. One of the stabilizers is gelatin, which is usually obtained from cows or pigs. So this is also one of the concerns. But the spokespersons of Pfizer, Moderna, and AstraZeneca, the three top vaccine makers, have clarified that pork products are not part of the vaccines. Preservatives are added to vaccines to allow multi-dose vials to be used safely. A vial is a small container typically cylindrical and made of glass, used especially for holding liquid medicines. The final step combines all the components that make up the final vaccine and uniformly mix them in a single vessel. Then, vaccine is filled into vials or syringe packages sealed with sterile stoppers and labeled for widespread distribution. Vaccine storage and transportation is a critical task. Mostly, a vaccine is heat sensitive. Therefore, a specific temperature range should be maintained throughout till its usage. Otherwise, it can become ineffective. So this brings us to the end of today's discussion. Now, as usual, let's quickly revise the topics we discussed today. We started today with medical treatment, specifically in modern medicine. We saw three major treatment methods: preventive, symptomatic, and curative treatment, after which we talked about preventive treatment methods of COVID-19, in which we discussed different measures to be taken under COVID-19 appropriate behavior, from sanitizers to quarantine. Then, after briefly discussing smallpox, we moved to the next topic of immunization, in which we saw active immunization can be achieved naturally through natural infection or by implanting antigen through inoculation. Furthermore, we discussed ancient methods of inoculation, variolation practices in China, India, and Africa. Then we learned about the story of Edward Jenner and his hypothesis and how he made the first vaccine of smallpox. And lastly, we talked about steps involved in the development of vaccines and some misconceptions and myths regarding vaccine manufacturing. In the upcoming video, we will be discussing topics like types of vaccines and vaccine approval procedure. So make sure you subscribe the channel and press the bell icon for timely notification. If you enjoyed and learned something from this video, then make sure that you like the video and share it with others so that we all work together and battle the infodemic. If you have any suggestion for me, you can comment below. That's all for now. We will meet in the next video. Till then, stay safe, stay connected.